Good morning. Welcome to today's discussion on Psyfeld, the episode The Mom and Pop Store. So, from the group, which character, which scene would you like to start?
I was thinking about Kramer and its constant nosebleeds. When I was looking at it, I thought that it could be something regarding actually substance use, like cocaine, because he seems very high-strung, energetic, and he kind of displays some of the symptoms that I think about when I think about it also. And I think it's from the same nostril every time. I think it's his right side, but I'm not 100% sure. I didn't go over and rewatch it, but that's the thing that stuck out to me, I thought.
Yeah. So I will often mention and reassure my third-year medical students, my clerks, that nosebleeds on a psychiatry shelf exam is cocaine use disorder until proven otherwise. And there are a couple of ways in which that can present on a standardized exam. Number one is when a patient presents in a hyperadrenergic state. So they have palpitations, they are sweating, they have a tremor, and they feel anxious. The single best answer looks to be a panic attack, or if these are recurrent and clinically significant, panic disorder, right? So I think that's the first thing that should come to people's minds. However, that constellation of symptoms, along with a nosebleed, will allow for a cocaine-induced anxiety disorder or a stimulant-induced anxiety disorder to actually be the single best answer. So that's one very common way. The nosebleed usually presents on a standardized exam, starting with a panic attack, but I think that is the single best answer, would be a cocaine-induced or stimulant-induced anxiety disorder. The other way is that you have the exact same scenario, but the individual has laboratory results come back that shows that the heart muscle, the myocardium, has been damaged. So this is usually either an aldolase or a troponin or a CK, specifically the CK-MB fraction. These are blood proteins that are leaked from the damaged myocardium, the damaged heart muscle. That changes the clinical scenario to an acute myocardial infarction or an acute MI. So the acute MI is nothing more than a panic attack plus evidence of that myocardial ischemia, as per those lab results. In each case, the MI is due to cocaine. Again, cocaine. Let me just take one step back. An acute MI in a young person, so someone who is at low risk for having coronary artery disease or atherosclerotic heart disease, is cocaine use until proven otherwise, right? So a urine tox or a serum toxicology would be the next step to see if the etiology is in fact cocaine intoxication. So those are the two ways in which the nosebleed might inform the single best answer on a psychiatry shelf or really any standardized exam. The other thing that I thought was interesting pertaining to your observation and Kramer's nosebleeds is that the final scene, I think, also relates to his nosebleeds. So anybody remember the actual final scene of the mom and pop store?
When he's on the bus, I think he's like sweating also because Jerry's like patting his head with a tissue or something.
Anybody know what that's a reference or an allusion to?
Midnight Cowboy?
Yeah. Which also happens to be a movie about, among other things, drugs. So there's another association with regard to the cocaine use. The other part, if nobody's ever seen Midnight Cowboy, and I really won't give much away, is that the character in this particular movie looks to actually have borderline personality disorder. And if you watch this film back to back with of all things, Star Wars, I think there is a major teaching point that you can draw out with that double feature. And that major teaching point will be depictions of borderline personality disorders, which often goes unnoticed and therefore undiagnosed in males. And both characters in their respective films, in the case of a Star Wars film franchise, are males, right? And I'm talking about Anakin. Any other observations about Kramer in this episode, the mom and pop store? What other characters caught your eye? Nothing else?
I was also thinking about George, actually, which was kind of like the same thing that we always talk about, where he's really easily persuaded and he does his homework on the car, but he gets switched because he thinks that a famous actor does this because he wants to impress his friends and seem cooler to everyone else and just have a higher, because he relies on other people so heavily for how he feels about himself.
Yeah, I mean, again, I think while I would probably fall short of diagnosing him with histrionic personality disorder, and I said this more than once, we can create an entire curriculum around George Costanza. His behavior, episode to episode, certainly identifies traits that allows for discussion of a very wide range of psychopathology. And in this particular episode, his need to be the center of attention, boasting that he owns John Voight's car. John Voight, of course, the actor in Midnight Cowboy, yet another link back to that film. I think it's consistent with histrionic traits. So remember, the cluster B personality disorders for shelf exams are best learned and therefore best identified by remembering that cardinal trait. And for the histrionic personality, the focus is going to be on the need to be the center of attention. And individuals like George will go through excessive lengths to ensure that the conversation is always about or around them. And you could then recognize how the realization that this is John Voight, the periodontist car, and not the actors, might deflate that for George. And why he acts the way he does upon that discovery by kicking Jerry out of his car in a neighborhood that is unfamiliar to him. Yeah. By the way, what are the other three cluster B personality disorders?
Is antisocial one of them?
Two more.
Narcissistic and borderline.
That's it, right? Now, three of the four have that cardinal feature, all right? So individuals with antisocial have a blatant disregard for and violation of others' rights, and individuals who are narcissistic are arrogant and haughty, believe they are special, and also believe that they could only be understood by someone as special as they are. Okay. The outlier here is the borderline personality disorder. Individuals with borderline do not adhere to a cardinal trait. It's going to take a little bit more time to review borderline personality disorder to be able to identify it on a shelf exam. However, because of its prevalence, especially in individuals who present both to ambulatory as well as inpatient units, I think the clinical experience of a third-year clerk in psychiatry will certainly allow their identifying borderline as a single best answer on a final shelf exam. And if you ever want those traits to be cemented, check out Midnight Cowboy and Star Wars back to back. You have to go to the final trilogy. I'm sorry, the middle trilogy. But you'll never forget Borderline Personality, albeit in that particular fictional case depiction in a male. Any other characters? The mom and pop store caught your eye.
I thought it was maybe a significantly abnormal behavior when the actor John Voight bites Kramer.
Yeah, I'm not sure what to make of that. First of all, I agree with you. I don't know where to start with that one. The scene is so short. Obviously, it's a cameo. That I couldn't even put it together as to what may have motivated that behavior. I really can't. Certainly, there seems to be a blatant disregard for Kramer's well-being. There's nothing more there to suggest antisocial personality disorder beyond that. However, if we were able to get a history, and again, I want to be careful here because John Voight portrayed himself in this situational comedy. So we're talking about his actions in a fictional sense, as observed in the mom and pop store. And none of this discussion alludes to anything that John Voight has done outside of that episode. What piece of history might actually support that his biting Kramer is in fact consistent with, let's say, a predisposing illness or an underlying illness? If you had an opportunity to ask him any questions, what are your high-yield questions to see if there's anything there? So I think if you could ask or would inquire about any evidence of cruelty to animals, destruction of property, defiant behavior prior to the age of 15, these are all clinical signs consistent with conduct disorder. That would be of high yield. If you were able to obtain a consistent history or a history consistent with conduct disorder, I think the perspective of his biting Kramer would be significantly changed. But without that is, without a history of conduct prior to the age of 50, individuals cannot be diagnosed with antisocial personality disorder at 18 years of age or older. Any other characters?
I guess Elaine's older boss wanted to be in the parade, and they made a comment that it was mainly a lot of kids that wanted to do that.
Yeah, Mr. Pitt gives us a brief look into his childhood. I think he may have used the word strict, and certainly he gives us the impression that he more times than not, he was not allowed to be a child at a young age growing up in his home. And we could also see, although apparently functional, that Mr. Pitt still has that part of him that wants to explore and do those things that he was not allowed to when he was 6 or 7 or 8. And I think that's certainly appears to be motivating what he is doing and what he is asking, I'm using the term asking loosely, Elaine to do. So this is not that men my age per se who enjoy cartoons are trying to fill a void 100% of the time, but given what Mr. Pitt discloses to us, there does seem to be some early childhood experiences that are motivating his adult behavior, which, again, I don't think would necessarily be news to anyone, as early childhood experiences almost always motivate our adult behavior that's normal as well as abnormal. What's interesting is that the balloon that he wants to, the strings of which he wants to hold during the Macy's Thanksgiving Day Parade happens to be Woody Woodpecker, and there is dialogue around this particular character being a troublemaker. So I think that we could explore what Mr. Pitt really wanted to do. Again, he wanted to get in trouble as a kid. He wanted to do those normal things that kids do in terms of pushing the ticket and finding their own autonomy. This is normal childhood behavior, until it's not. And it doesn't look like he was able to do that. I would suspect that his parents did not allow for him to feel autonomous, that they were very strict. He had firm boundaries, and he was never really allowed to push those boundaries or push the ticket. Hence why Woody Woodpecker is his favorite cartoon character. Not sure why they didn't pick Bugs Bunny. He's I think a much more problematic childlike character, but Woody Woodpecker does fit the bill. Anything else? Anything going on with Jerry or any other characters? I will say this to close out our discussion today. It's a loose association, but Jerry, and what happens to Jerry when Kramer does kick him out of the car, and therefore he does crash that party, loosely associated with regard to oral hygiene. Oral hygiene is something that psychiatrists cannot ignore. A lot of the medications that we prescribe have fairly significant anticholinergic side effects, which includes dry mouth. And if an individual is complaining of any anticholinergic side effects, dry mouth, constipation, etc., the risk of dental caries is significantly high. So, number one, we always inquire about the side effects of medications that we prescribe, and I would think that among the biggest culprits here would be the newer generation, that is the second generation antipsychotics, referred to as the atypical antipsychotics. Atypicals are atypical because they have an atypical mechanism of action. The typical mechanism of action of an antipsychotic is to bind to the dopamine subtype 2 receptor, referred to as the D2 receptor, and block it. And by blocking the dopamine subtype 2 receptor, that D2 receptor, we downregulate dopamine metabolism in the brain. And as a result, symptoms like auditory hallucinations and delusions improve. Right? So those symptoms, hallucinations, other perceptual disturbances, fixed belief, that is delusions, are a product of a hyper dopaminergic state in the central nervous system. By prescribing an antipsychotic, we block dopamine and therefore improve those symptoms. The newer generation, that is the second generation antipsychotics, regulate dopamine indirectly, right? So they don't, or they bind directly to the D2 receptor much more loosely as compared to the original medications, that is the first generation antipsychotics. But by lowering dopamine indirectly, they hit a bunch of other receptors. And one of those receptors happens to be the muscarinic receptor, specifically the M1 receptor, the muscarinic subtype 1 receptor. And the anti-muscarinic effect is an anticholinergic effect. The muscarinic receptor mediates acetylcholine metabolism. Block that receptor, and you have an anticholinergic effect. You lower acetylcholine in the central nervous system. And that comes with a bunch of side effects, including, but not limited to, that dry mouth and constipation. So medications like the atypical or the second generation antipsychotics can induce constipation, dry mouth, and therefore dental caries. No, the constipation has nothing to do with the dental caries. Induce dry mouth and dental caries. So that's something, again, very loosely associated with what Jerry has going on. His is obviously a chipped tooth, a fracture. Nothing to do with anything beyond that. But in psychiatry, oral hygiene is something we address, and we address it when we prescribe any medication with an anticholinergic side effect. And among the biggest culprits are the second generation, that is the atypical antipsychotics. What are the other side effects of the atypicals? We have some third-year students on board here. The third years could enable their video. Looking for side effects of the atypical or second generation antipsychotics other than the anticholinergic side effects.
There are metabolic side effects like hyperlipidemia and hyperglycemia, weight gain.
Excellent, yeah. It's a little unclear what mediates that. We originally thought that was largely an antihistamine side effect, that is, an increase in appetite resulted in an increase in calories and therefore all of those metabolic sequelae that you just mentioned. Psychiatry must check a fasting blood glucose every 6 months, as well as a fasting lipid profile every 12 months on their patients, provided these atypical antipsychotics. We think it might be cortisol mediated because there has been the observation, and this has been established in the medical literature, that people who don't gain weight are still at risk for diabetes and dyslipidemia. So metabolic side effects, absolutely, very, very important to follow. Anything else? So the acronym is STOMAS, S-T-O-M-A-S. These medications as a class are very sedating. That is also an antihistamine effect. Anybody who's ever taken an antihistamine knows they can be sedating. The T stands for torsades, which is a potential life-threatening ventricular arrhythmia. So we get routine EKGs on our patients. Depending on their risk, the frequency may be as often as every 3 to 4 months or annually. Orthostatic hypotension. So if they, from a recumbent position sit or from a sitting position stand, they can have an abrupt drop in their blood pressure and a consequent increase in their pulse rate, and they could feel faint, and they could even be pre-syncopal. They could actually nearly faint and nearly lose consciousness. That's likely an alpha-1 effect. So that's the alpha-1 subunit. M we mentioned, metabolic. A we mentioned, anticholinergic. And the final S is that these medications do lower the seizure threshold. So seizures can be a side effect of these medications. Very common shelf exam question is an individual who is on clozapine, afflicted with schizophrenia, which means that there is probably between at least an 80 to 90% chance that they are a cigarette smoker. Your patient has been maintained on clozapine, which is an atypical antipsychotic, STOMAS, for years and has been stable. One day they present to the ER. They're presenting with new onset seizure. What happened? Very, very common test question. The question stem will read, the most likely cause of the patient's seizure is, Any thoughts? What's happened is that they have either reduced or stopped smoking cigarettes. Tobacco induces, that is, it revs up, an enzyme in the liver called 1A2 that metabolizes, that clears clozaril. So by smoking a pack or 2 packs of cigarettes a day, as a prescriber, you have managed your patient on an excessive dose of clozapine or clozaril so as to address their psychotic symptoms. If the individual significantly reduces the amount they smoke or stops, you lose that inducing effect. And therefore, your clozaril levels will actually increase significantly, resulting in a seizure. Very common test question. Tobacco is a 1A2 inducer. Several antipsychotics are metabolized through that 1A2 isoenzyme, and their levels can go to toxic levels if your patient is not told to contact you when they decide to quit smoking. Clozaril is considered to be, clozaril was the first atypical antipsychotic discovered, and it is considered to be the most atypical of the atypical antipsychotics. That is, it most loosely bounds to that D2 receptor, and consequently, it hits a lot of those other receptors more so than any other drugs in its class. Case in point, there have been reports in the literature that the onset of diabetes is as high as 33%, so 1 in 3 who go on this medication go on to develop diabetes. So metabolic side effects, 1 in 3. The most atypical acting of the medications in the atypical class is clozaril. Another way this comes up on exams. A patient presents to you with known Parkinson's disease. Parkinson's disease is an illness in which the cell bodies that synthesize dopamine are dying, and therefore there is too low a dopamine level in the central nervous system. The individual has new onset psychosis and requires an antipsychotic. Which antipsychotic has the most favorable mechanism in this clinical scenario? And the single best answer is clozaril. Again, clozaril will bind to that D2 receptor the loosest among any other medication in its class. If the question stem reads, which of the following medications is the best to prescribe, clozaril may be listed there, or it may not be, because it is a second-line agent. So if they're asking about which mechanism, it's going to be clozaril, but if they ask which medication is to be prescribed in the above scenario, clozaril being a second-line agent is not going to be your single best answer, even if it is listed in the answer set. Any clerks want to take a guess at which medication would be then next in line and therefore the single best answer in this scenario? Quetiapine. Quetiapine or Seroquel is the single best answer here. Quetiapine is the medication with the, let's say, next loosest binding potential, if that's actually a term, after clozaril. Quetiapine, that is Seroquel. And we see this a lot in the hospital when an individual requires an antipsychotic for delirium, but they're on the 7th floor because they have Parkinson's disease. So you don't want to directly bind to the D2 receptor because you'll exacerbate Parkinsonism, but then again, you want to address the psychotic symptoms. So you've got to give an agent that lowers dopamine indirectly. And if you're thinking mechanism, it's going to be clozaril, but if you're thinking medication, clozaril, a second-line agent, is not an option. Seroquel is the next best answer. All right, we'll leave it there, right at the bottom of the hour, 8:30. Red team, hopefully I'll see you in about 30 to 40 minutes. Thank you.